Hello, my name is Africa Kanyi. I'm an occupational therapist at Oasis Health Specialty. So, occupational therapy is activity-based treatment that aims at promoting independence in performance of activities of daily living. Activities of daily living are day-to-day activities that we do. Things like feeding, bathing, bed making, any normal thing that we do every day. So we find that after an illness, one is not able to perform to partake their ADLs, the activity of daily living. So that's where occupational therapy comes in. Well, after a mental illness, most of the time we find that patients are not able to partake activity of daily living, as I had mentioned before. Things like taking a shower, making their own beds, socializing. And so that's when OT comes in. And OT, most of the time we do it in group setup, and all the time it has to have an activity. So through that, I would give a good example of maybe when a patient is suffering from depression. One, we find that they are not able to fit socially or they seclude themselves. But in the activity group, once you put them there, kidogo they adjust to their normal ways, that is, they are able to socialize unknowingly most of the time. And also in the group, as we do the activities bring about joy. That is an important aspect, as one is also healing. Well, at the facility, I want to mention the activities we have at the facility. We have beadwork, we have indoor games that include Scrabble, Monopoly. We also have tailor-made games that we've come up with at the facility, things like spoons. We have outdoor activities as well. And it's not all about play. Occupational therapy also helps patients we have patients who don't have insight of what they are going through. So we have activities like debates or group discussions whereby we try to bring about the insights back to the patient. Yeah. Well, as occupational therapists, we say man is an occupational being. That means we have to have a balance between, we have aspects that makes a person. That is productivity, leisure, and now the activity of daily living. Productivity would be work or something that it doesn't also mean that it will be of economical benefit to you, so long as it is gratifying to you. So as a normal person or someone who's trying to put their mental health in check, you should at least, an OT would come in to help you with the balance between leisure, productivity, and performance in activity of daily living. And that would come in also we also help in time management, development of schedules, and let me say exploration of leisure as well. Yeah. Okay, there are people who don't really know what they do or as hobbies or what they love doing. So I would come in as the OT there and help you with that. And we also find there are things we call instrumental activity of daily livings. Those are things that we do every day but require a high cognitive reasoning, I would say. Things like making a phone call, things like going to shopping, using transportation. After illness, or even for a normal person like myself, at times we become overwhelmed and you're not able to do that. So the occupational therapist would help you with that as well. Yeah.